Hi there, my name is Dr. Christopher Pena. I am the scientific liaison at the University of Chicago Comprehensive Cancer Center, and I am here with Dr. Megan Mekinda.
Hi, I'm the Assistant Director for Cancer Education, also at the University of Chicago Comprehensive Cancer Center, and we have brought with us here today some of our students from the Chicago Eyes on Cancer and Research Start programs that we have through the center. So these are programs for high school and college students who think that they might want a career in biomedicine, and our students spend the summer working in cancer research laboratories alongside our faculty, and the goal is to give them research experience and some career development, but honestly, these kids are working at the front lines of cancer research and cancer care. So they are contributing to some of the cutting edge work that our faculty are doing to understand cancer, and hopefully this information is going to help us defeat it.
Awesome. Well, these students are incredibly excited to share their research experience and their knowledge with you. Today is part 2 of a 2-part series in terms of cancer treatment. We have another 2 episodes that will focus on cancer diagnostics and prevention, and our last episode will focus on cancer survivorship, which is basically living with cancer after you have been treated and diagnosed, and the lifestyle changes that can be associated with that.
Mm-hmm. And we hope you enjoy these programs, and we really hope that you're impressed with these students. These are high school and college students, as I mentioned, but already they are really skilled researchers and talented scientists, and we truly believe that these are the faces of the newest and brightest generation of cancer researchers and care providers. So with that, I will say goodbye and make some room for your first guest.
Awesome. So if you want to join this great program, this is Chicago Eyes on Cancer and Research Start. The link is on the screen right there. You can also reach us at 773-702-4678 if you're interested or know somebody who is. I am here with my first 2 guests, Spencer and Megan. How are you guys doing today? Thanks for coming.
Doing well. How are you?
Good, good. So you guys are going to talk to us specifically about cancer immunotherapy. So why not tell us exactly what is immunotherapy?
Well, cancer immunotherapy is a new type of cancer treatment that uses our body's own immune system to find and destroy cancer cells.
You know, it's very interesting because I'm hearing a lot about immunotherapy in the news, on TV, even some drugs that are out there. Why is cancer immunotherapy so incredibly popular right now?
Well, there's 2 main reasons why immunotherapies are so hot right now. The first one is that in terms of treatments for cancer, immunotherapies are very, very specific, meaning that they'll kill only the cancerous cells and leave the normal cells alone, which is really important because a lot of the treatments that we have right now are non-specific. So in terms of radiation and chemotherapy, they're killing the cancer, yes, but they're also killing normal healthy cells, which is why the side effects are so prevalent. The second reason why immunotherapies are so impressive is because they're able to kill any type of cancer no matter where it is or what it is, in theory. There's many types of cancers and they all progress very differently. So it could be very, very time costly to try to find an individualized treatment for each type of cancer. However, if we're able to use the immune system and its ability to attack and destroy threatening and unknown cells to the body, then it can prove to be very effective for cancer treatments.
So that's interesting. Isn't the immune system really just known to fight off flu and cold and bacteria and viruses?
It's exactly the same immune system that you hear when you go to get your flu shot, when you have the cold, when you have a viral infection, all that. It's the same immune system that's used, but then we're using it to focus and find and destroy cancer cells.
Wow, so how does it do that exactly?
Well, to answer your question, let's look at how your immune system finds cancer cells in the first place.
Okay.
So imagine all your cells have a barcode, kind of like the items sold at a supermarket. Your immune system is basically like the scanner. What happens is that this scanner is able to scan the barcode on every cell by actually touching the cell and interacting with the cell. And when it detects an abnormal barcode, the immune system is actually able to destroy that cell.
So what's interesting is we all have immune systems. So if that's the case, and if the immune system can destroy cancer cells, why do we still get cancer?
So like I mentioned before, cancer comes in many forms and many shapes and sizes, and not all cancers equal. Because of this, certain cancers are able to be destroyed by the immune system, however others are not. Cancer is a very smart disease, and it's able to fool the immune system in many ways.
Great. So, if you know, if that's the case, why, you know, what kind of therapies are there that are related to the immune system?
Well, one common therapy we use is called chimeric antigen receptor T-cell therapy, and it's also known as CAR T-cell therapy. And this therapy is very commonly used for cancers that have been able to fool the immune system by making a barcode that the immune system can't read.
So, exactly what are T cells?
Yeah, I'm glad you asked. T cells are basically the soldiers of our immune system. I have a picture right here. And they are constantly on patrol throughout our whole body, searching for and destroying abnormal cells. So if we go back to our scanner and barcode analogy, as I just mentioned, the T cells have scanners that detect cancer cells, and the cancer cells are able to change their barcode so the scanner won't work. So CAR T-cell therapies actually changes this scanner to a different scanner that can actually recognize the abnormal barcode of cancer cells and destroy it.
So it sounds like this is a pretty interesting, effective therapy. Can it be used against every kind of cancer that's out there?
Unfortunately, no. So like I mentioned before, there's many different types of cancers and they're not all the same. Immunotherapies are extremely effective for some cancers, but not as effective for others. For example, there's some cancers, such as certain types of lung cancers, that have developed ways of turning off the barcodes or turning off the T-cell scanners. So for these cancers, not even the CAR T-cell therapies will work. In the lab I'm working in right now, we're working with one of these types of cancers that isn't very responsive to immunotherapies, which is prostate cancer. So what my lab works on doing is studying the different mechanisms that cancer can use in order to evade these immunotherapies. And by studying these different mechanisms and the genetic markers that cancer has, we're then able to figure out ways in which we can use the system that we're working in and combine treatments that exist or treatments that we're coming up with to better treat patients with cancer and make these immunotherapies more effective.
Wow. So what kind of research are you doing in immunotherapies?
Well, I work at the Huynh lab, and at the Huynh lab we test ways to improve the T-cell scanner and allow it to recognize more cancer cells. So I have an example right here.
Sure, let's go ahead and pull that up.
Yeah, so in this example is a video that I actually collected, and what you can see in this video is you can see that we're working at a single cell level trying to characterize the interaction between a cancer cell and an immune cell. So you see the two circles on that video right there. They're both cells. The one on the left is a normal cell you would find in the human body. And the one on the right is our immune system cell. You can see how the cells are joined together right now. However, when we pull them apart, the cell on the left, our normal cell, sticks to our immune system cell. That indicates that our immune system cell is scanning the barcode of our normal human cell. So what we're testing, and what I'm specifically testing, is I'm testing various drugs that hopefully increases the amount of times these immune system cells and normal cells stick together. And hopefully that will let us basically have our immune system stay always active and able to find and destroy nearly every cancer.
Wow, that's really interesting work, and that video I think is very telling, just to see how these two cells kind of interact with each other. So I want to thank you guys for sharing your important work with us right now. We're going to go ahead and take our next guest in a second. So I am, going to bring our next guest on. So again, we are Chicago Eyes on Cancer and Research Start. We are a program out of the University of Chicago that gives high school and undergraduate students the opportunity to do research in a lab. If you are interested in joining this program, we have a link for you on the screen right there, or you can give us a call at 773-702-4678. I'm here with Neha, and you're going to tell us a little bit about your research. So welcome, and thanks for stopping by here. So I think my first question for you is exactly how do immunotherapy and cancer drug treatments relate?
So actually, cancer drug treatments are a form of immunotherapy. These drugs have been developed and designed based on the normal immune system and what we know about how the immune system works.
Great. So can you give us some examples of different therapies that treatments that can be used?
Yeah. So I would say there are two types of drug treatments. The first type would be the drugs that work with the immune system to fight cancer. The second type of drug treatments are those that enhance or strengthen the immune system to fight the cancer. So an example of the first type that works with the immune system to fight the cancer would be a checkpoint inhibitor. And what this does is cancer is a disease that can tend to hide itself from the immune system. That's why cancer can grow and progress really quickly and easily. So what checkpoint inhibitors do is they find the cancer cells and help the immune system identify the cancer cells so that the immune system can fight the cancer. And then, like I said before, their second type of drug treatments are the ones that enhance and strengthen the immune system to fight the cancer. And one example of that is actually BCG, which is used to treat bladder cancer. Mm-hmm. And BCG is basically a bacteria. It's a very weakened form of the bacteria that causes tuberculosis, actually. And what happens is this bacteria is inserted into the bladder via a cathode. And what happens is this BCG basically attracts the immune system cells to the bladder and then activates the cells so that strengthens the immune system and allows the immune system to attack the cancer.
Wow, so let me get this straight. BCG is what causes tuberculosis, and you're actually injecting that into a patient or by a catheter. So is that harmful?
Actually, it is not, because like I said before, it is a very, very weakened form of the bacteria that causes tuberculosis. This bacteria is also used in TB vaccinations. So it's not harmful at all. And also, remember, we have a lot of bacteria in our own bodies, such as our gut bacteria. So it would not be harmful.
That's true. That's true. So can you tell us a little bit about the type of cancer that you're currently studying in the lab right now?
Yeah, so actually I'm studying what has recently been considered a cancer. Previously it was actually called a pre-leukemia disease. It's called myelodysplastic syndromes, or MDS. And what MDS is, it's basically a group of malignant conditions that block stem cell development. So what that means is there's a genetic mutation that happens that causes MDS, and that basically disrupts the way that bone marrow cells work. That actually causes there to be less red blood cells in the body. And red blood cells are very important because they help carry the oxygen throughout the whole body. So patients become blood transfusion dependent or bone marrow transplant dependent for the most severe cases, and that can cause there to be a reduction in lifespan and then also a compromise with the quality of life.
Wow, so it sounds like when these patients undergo this cancer, they're losing their red blood cells. Yes. So does your research try to focus on replenishing those red blood cells?
Yes, what my research does is we're testing 2 different drugs to see which drug is the best at increasing that stem cell differentiation to increase the red blood cell count. Therefore, patients don't have to rely on blood transfusions or bone marrow transplants. That will increase their lifespan, and their quality of life will be very good too at the same time.
Wow, so it sounds like your research really has an impact not just on the actual cancer, but survivorship as well and the quality of life that these patients are having. So I want to thank you for stopping by and sharing that with us and doing the awesome work that you're doing right now. So thank you. Yeah. So again, we are Chicago Eyes on Cancer and Research Start. We are based out of the University of Chicago, and we are a summer program for both high school and undergraduate students who are curious about working in a cancer biology laboratory and understanding some of the clinical research that's behind the oncology field. If you are interested or know somebody who is interested in a program like this, you can visit the link that is shown on the screen right now. You can also give us a call at 773-702 4678, and we'd love to have you. My next guest is Jose, and he is a high school student in our program, and he's going to tell us a little bit about the cancer that he's studying. So welcome, Jose.
Oh, thank you. Well, I'm studying pancreatic cancer, more specifically pancreatic ductal adenocarcinoma. For short, it's PDAC. So it is a very, so it's one of the deadliest malignancies out there. It has a very low survival rate. It's 8% within 5 years, which is pretty low. So it starts with just the pancreas just growing abnormally without control. And well, the function of the pancreas is very important for the human body because it secretes hormones and various enzymes that are needed.
So I've always heard about pancreatic cancer being incredibly lethal and such a problem, primarily because the difficulty that comes in treating it. So why is pancreatic cancer so hard to treat?
So it is very hard to treat because by the time it's diagnosed, it's too late. Like the cancer may be at stage 4, and so by that time the cancer has already spread through tissue, like nearby tissue and other organs inside the body. And also there are very limited amounts of like drugs to treat pancreatic cancer.
Wow. I've also, and you can tell me if this reigns true as well, surgically it's really hard to remove tumors from the pancreas just because you have your liver, your digestive tract, all that's kind of in front of it. Is that true?
Yeah, so surgically, it cannot be surgically removed because, so like I said before, it's like by the time it's diagnosed, it's stage 4, so it has already spread throughout the whole body. So it's like it had to go inside the whole body, so it's going to take a really long time, and it's just not a viable option for the patient.
Wow. So why don't you tell us specifically about the research project that you have?
So the project I'm doing, I'm working with pancreatic cancer cell lines that are allogenic to the splenocytes in the spleen. So this means that the splenocytes will kill the cancer cell line because the immune system recognizes it. We also give a drug that we're trying to work with, and we expect to see fewer cancer cells because of the drug. And well, we expect that the immune system is not suppressed by the drug.
Great. So what is the ultimate goal of your project with this drug?
So the goal is to just release a new drug to the public, try to increase the survival rate, and try to have a longer lifespan for the patients.
Great. And how is immunotherapy specifically involved in your line of research?
Well, the immune system it's involved because the T cells are used to fight off cancer. But if the drug that we're trying to come up with suppresses the immune system, then the drug will not be as efficient as we want it to be. And so we just want it to be as efficient as possible.
Great. Well, thanks for sharing that with us, and it sounds like you're doing incredible cutting-edge research and that you're really making a contribution in the field. So thanks for stopping by. Again, we are Chicago Eyes on Cancer and Research Start. We are a program based out of the University of Chicago, specifically for high school and undergraduate students that want an experience working in the laboratory, specifically one that studies cancer biology and clinical activities that are associated with cancer research and treatment. You can reach us at our website that's on the screen, or you could give us a call at 773-702-4678. So I have here Megan and Spencer, and they told us a little bit earlier about their research, but now they're going to talk a little bit more about their experience in Research Start and Chicago Eyes on Cancer. So if you guys want to go ahead and share that with us.
Sure. So my name is Megan, as already mentioned, and I'm in my second year with Chicago Eyes on Cancer, formerly the CURE program. And it's this awesome 2-year program in which you're able to be assigned to a lab for both 2 summers consecutively, and in the meantime you also are assigned different projects to work on career development. And it's an awesome program. I love it because it's 2 years long, so you get to kind of grow and develop with it. It's more than just an 8-week program that a lot of universities offer, and it's very personalized. So myself, I'm an undergraduate. I'm going into my last year of college, and I was a little bit hesitant about coming into the program because I knew it was mostly for high school students or students coming into undergrad. However, the program has been very personalized to each student coming into it. They're very aware of where you're coming in with your classwork or your experience of just science and what you know, and your lab techniques. And I was able to be put into a lab that was at, like, fit my standard, fit where I was in my educational career. So in terms of the personalization of the program, I think it's phenomenal. And I think the fact that you're able to grow and develop for 2 years, both in terms of techniques and education as well as career development, is phenomenal.
Great.
Yeah, so I am a Research STIRT student. Research STIRT, unfortunately, is only a one-year program, but I do think that it has a lot of benefits. So Research STIRT, it does have more than one site, so I do research at University of Chicago. However, we also have students in the program that come from University of Illinois in Chicago or in Urbana-Champaign, as well as Northwestern. So to be able to talk to students from all these different universities and see the variety of research they are doing is really nice, as well as the ability to go to the campuses there and kind of learn about the colleges. So I think that for me, joining this research program was really daunting because I've never done research before. I've of course heard about kind of research, I was interested in it, but I didn't really know what research entailed. So going into the lab, it was a very steep learning curve, especially being with such talented researchers. I know that, like, at lab meetings where I would like have to present scientific papers to fellow lab workers as well as the professor that I worked with, was really scary. However, despite the steep learning curve, they do treat you very nicely. They do understand you're a high school student, and they slowly but quickly immerse you into this environment where you can quickly understand what it's like to be a researcher.
All right. So why don't both of you share what has been the most rewarding part of your experience this summer?
So for me, my summer has been really awesome. Last year I was able to work in one lab, and I got to grow with their team, but I think the best part about my program is, like I mentioned, the longevity of it. And so I was put into a new lab this year, and I've loved it. The fact that I get to experience a new environment and experience science from two different perspectives has been so rewarding to me. And the fact that I can see my growth from where I started when I first came into one lab last year, and how I was able to take that knowledge, even though I'm in a new setting, and apply it to my new home and where I'm working right now, has been incredible. So I think the fact that, like, I'm able to bring these pieces along the way with me and pick up and learn from so many people around me has been so rewarding.
Good.
Yeah, so I guess going into the lab for me was really exciting because, like, as I showed before, my research is into immunotherapy, so I got to really dive deep into immunotherapies and learn about all the technicalities with giving immunotherapies and how perhaps our immune system and how cancer cells work. But at the same time, I think a program like this gives you exposure to many different students doing many different research topics. So I was also I really enjoyed learning about other types of research. Maybe it could still be in kind of like a lab environment, a wet lab, which is kind of the conventional lab environment where we're working with cells and chemicals, but also being able to talk to people and learn about their research from people who work in dry labs, which work with like data analysis or computer science. So I guess the ability to have a diverse range of experiences in what you learn about research, but also at the same time be able to dive into a specific topic was what makes this program so good.
Well, thank you for sharing that with us. We're going to go ahead and just say one last time who we are. We are Chicago Eyes on Cancer and Research START. We are a program for high school and undergraduate students out of the University of Chicago that gives them the opportunity to do research in a cancer biology lab. So if you are interested, we ask that you follow the link on the screen, or you could give us a call at 773-702-4678. Again, I want to thank you guys for coming, and we're going to continue this series. Our next episode will be about cancer detection and biomarkers and prevention. And our last episode will focus on cancer survivorship, which is living with cancer and what it's like to go through cancer and different changes in your lifestyle. So thank you for tuning in, and we look forward to seeing you next time.